Hey everyone, Dr. Oz here. Let's talk about something that's helped millions of men and surprised millions more. I'm talking about Viagra, the little blue pill that revolutionized the way we think about, well, you know. You might be surprised to learn that Viagra wasn't originally intended for what it's famous for. It was first studied as a treatment for high blood pressure and chest pain. Can you imagine? It's amazing how life takes unexpected turns. Today, Viagra is best known for its ability to help men with erectile dysfunction, but like any medication, it comes with its own set of side effects. Don't worry, we're going to break it all down in plain English, so you know exactly what to expect. Let's dive in. In the simplest terms, Viagra is like a plumbing assistant for a very specific part of the male anatomy. It helps to ensure that everything flows smoothly when it needs to. You see, when a man gets aroused, his brain sends signals to the blood vessels in his penis to relax and let more blood flow in, which causes an erection. This process is crucial for sexual activity and intimacy. Sometimes, though, those signals get lost, or the plumbing isn't cooperating, and that's where Viagra steps in. It acts as a facilitator, ensuring that the blood vessels can open up properly. Viagra, also known by its generic name sildenafil, belongs to a class of drugs called PDE5 inhibitors. These inhibitors play a key role in managing erectile dysfunction. Don't let the fancy name scare you. PDE5 inhibitors are just a type of medication that helps to improve blood flow by blocking a specific enzyme. All it means is that Viagra temporarily blocks an enzyme called PDE5, which helps to keep those blood vessels open wider and longer, allowing for a stronger and more sustainable erection. This can make a significant difference in sexual performance. But remember, Viagra is not a magic pill, and it doesn't work without sexual stimulation. You still need to be in the mood and have some form of arousal for it to be effective. Think of it as a team effort. Both the medication and the natural arousal process need to work together to achieve the desired result. Viagra sets the stage, but you still need that spark of romance to get the show going. It's about creating the right environment and connection with your partner to make the experience enjoyable and fulfilling. Now, let's talk about those side effects. It's important to be informed so you know what to expect and how to handle them. Every medication has them, and Viagra is no exception. Understanding these side effects can help you manage them better. The good news is that most side effects from Viagra are mild and tend to go away on their own. They are usually temporary and not a cause for major concern. Think of them as a minor inconvenience on the road to a more satisfying experience. Just like a small bump on a scenic drive, they are manageable. The most common side effects you might experience are headache. This is by far the most frequent complaint. It's a common reaction and usually not severe. Imagine a mild tension headache, nothing a little over-the-counter pain reliever can't handle. It's similar to the kind of headache you might get from stress or dehydration. Flushing, this is where your face turns red and feels warm. Kind of like when you're embarrassed, but without the awkwardness. It's a harmless reaction and usually fades quickly. Indigestion, a little heartburn or upset stomach, easily remedied with an antacid. It's similar to what you might feel after a heavy meal. Stuffy or runny nose like a mild cold, but without the sneezing and coughing. It's a minor inconvenience that can be managed with simple remedies. These common side effects are usually nothing to worry about. They are part of your body's adjustment to the medication. However, if they persist or become bothersome, it's always a good idea to chat with your doctor. They can provide guidance and possibly adjust your dosage to minimize discomfort. Now, let's venture a little further into the side effect landscape. These next few are less common than the greatest hits we just talked about, but it's still good to be aware of them. Changes in vision. Some men report seeing a bluish tinge to their vision or increased sensitivity to light. This is usually temporary and fades away as the medication wears off. Dizziness. You might feel a bit lightheaded, especially when standing up quickly. It's like that feeling you get when you stand up too fast, but it might be a bit more pronounced. Muscle pain. Some men experience muscle aches, particularly in their back or legs. It's usually a dull ache that goes away on its own. Remember, these uncommon side effects are just that, uncommon. Most men who take Viagra never experience them. But if you do, don't hesitate to reach out to your doctor. Section 5, Red Alert, when Viagra throws a curveball, serious side effects. Now let's talk about the serious side effects that can occur when using Viagra. These side effects are rare, but it's crucial to be aware of them and to seek immediate medical attention if you experience any of them. Asterisk priapism. This is a prolonged erection lasting more than 4 hours. While it might sound appealing at first, trust me, it's not. Priapism is a medical emergency that requires immediate treatment to prevent permanent damage to the penile tissue. If left untreated, it can lead to long-term complications. Sudden hearing loss. In rare cases, Viagra has been linked to sudden hearing loss in one or both ears. This can sometimes be accompanied by ringing in the ears, known as tinnitus or dizziness. If you experience any sudden changes in your hearing, it's important to stop taking the medication and seek medical help immediately. Asterisk, severe allergic reaction. Although rare, a severe allergic reaction to Viagra can be potentially life-threatening. Signs of an allergic reaction include difficulty breathing, swelling of the face, lips, or throat, and the appearance of hives on the skin. If you notice any of these symptoms, it's critical to get emergency medical help right away. Remember, your health is paramount. Always be vigilant about how your body reacts to any medication. If you experience any of these serious side effects, don't hesitate to call 911 or get to the nearest emergency room immediately. Your prompt action can make a significant difference in preventing long-term health issues. Stay informed and stay safe. Section 6, I think I'm having a side effect. Now what? First things first, don't panic. Most side effects from Viagra are mild and temporary. If you're experiencing something that's bothering you, the first step is to stop taking the medication and contact your doctor. Your doctor can help determine if what you're experiencing is indeed a side effect of Viagra or something else entirely. They might suggest adjusting your dosage, switching to a different medication, or exploring alternative treatment options. Remember, communication is key. Don't be embarrassed to talk to your doctor about any concerns you have. They're there to help you achieve the best possible outcome for your health and well-being. Section 7, Viagra and grapefruit juice. A match made in... Here's a fun fact for you. Grapefruit juice and Viagra don't mix. It sounds strange, but it's true. Grapefruit juice can interfere with the way your body breaks down Viagra, leading to higher levels of the medication in your bloodstream. Think of it like this. Imagine you're trying to fill a bathtub, and you accidentally leave the faucet running at full blast. That's kind of what happens when you mix Viagra and grapefruit juice. It's like turning up the Viagra faucet in your body, which can increase the risk of side effects. So when it comes to Viagra, it's best to steer clear of grapefruit juice altogether. Stick to water or other beverages that won't interfere with the medication. Section 8, to pop or not to pop. When Viagra is a no-no. While Viagra can be a game changer for many men, it's not for everyone. There are certain situations where taking Viagra can be downright dangerous. If you're taking nitrates for chest pain, angina, Viagra is a big no-no. Nitrates and Viagra can cause a dangerous drop in blood pressure, leading to dizziness, fainting, or even a heart attack. It's crucial to tell your doctor about all the medications you're taking, including over-the-counter drugs and herbal supplements, to avoid any potential interactions with Viagra. Section 9, Straight Talk, Viagra, and your doctor. A must-have conversation. Before you even think about popping that little blue pill, there's one crucial step you absolutely cannot skip: talking to your doctor. Why is this conversation so important? Well, for starters, your doctor can help determine if Viagra is right for you based on your overall health, medical history, and any other medications you're taking. They can also help you understand the potential risks and benefits, answer any questions you might have, and make sure you're using Viagra safely and effectively. Remember, open and honest communication with your doctor is the foundation of a healthy and fulfilling sex life. Section 10. Viagra, your ticket to a better sex life. Use it wisely. Viagra has helped millions of men around the world overcome ED and enjoy a more fulfilling sex life. But like any medication, it's essential to use it responsibly and to be aware of the potential side effects. By following your doctor's instructions, being mindful of potential interactions, and listening to your body, you can minimize the risk of side effects and maximize the benefits of this revolutionary medication. Remember, knowledge is power. The more you know about Viagra, the better equipped you'll be to make informed decisions about your health and well-being. And as always, if you have any concerns or questions, don't hesitate to reach out to your doctor. They're your trusted partner on your journey to a healthier and happier you.